Good morning. It looks like we're live on YouTube, and hopefully this is streaming into the group, so you may be watching it inside the app, or you may be live with me or coming on live here in YouTube land. So if you're here and if you do come on live, there is a chat function. So find the chat and say hi and check in and say hello. It would be awesome. But if not, if you're watching the replay, you can always send me a message or comment if I post the replay into the Facebook group or wherever we are. Please post your comments and let me know any questions. Okay, so today we're going to get started. My oil of choice today is helichrysum, also sometimes known as immortelle or everlasting. And it's a very, very, very versatile oil and very safe for dogs and animals as well. This is part of my first aid kit. It's absolutely brilliant for bruises and cuts to disinfect, cuts and wounds. You can put this directly onto wounds, unlike some of the other oils. So this is really, really good for your first aid kit. And this particular week, this week past, I have used it 3 times. Once was for myself. I had some mucus that was sort of a very thick mucus at the back of my throat that I couldn't seem to get rid of. And just inhaling that really helped because it's an what do they call it? Anti-mucosal, basically dissolves phlegm and that kind of thing. So great for chest and throat as well. But also particularly, as I said, for wounds, cuts, bruises, brilliant for bruises. The other time I used it was Layla had a little rash on the inside of her thigh. I'm not sure she was licking there, so she had a bit of a rash from the licking. And I just put a drop of this with some fractionated coconut oil, and it was gone within seconds. Well, not seconds, but certainly within the day, she had stopped licking and the rash had gone. So that was really good. And the third one was, yes, my husband stubbed his toe. And I came out with this and avoided the bruise from happening in the first place. So I really love this oil. It's also not only for bruises of the body, but also bruises emotionally. So animals or people with any past trauma, or if you're holding resentment or from past events and things like that, this is also one of these oils that's really good for the soul and for the emotions. So to release that trapped energy, to release that trauma, and to help process that those resentful feelings or hurtful feelings from the past. So for bruised soul as well. So that's my oil of choice, helichrysum, also known as everlasting or immortelle. So today's topic is your dog in pain? What has pain got to do with behavior? And what about illness? What about illnesses? What have they got to do with behavior, if anything? So many of you may have heard from learning previous things or from hearing YouTube or whatever it is, that dogs who experience pain can often show different kinds of behavior problems. And this is pretty well known, although not well known enough, because there are studies out to show now that dogs that are seen by vets for pain, so they go in because their dog is limping or hurt or sore or have got some kind of chronic pain, those same dogs have also by the vets been reported to have things, behavior problems like anxiety or reactivity or oversensitivity, those kind of things, allergies. And so at first it was perhaps just a coincidence, this dog has got all these issues, but now they're seeing a relevant connection between the pain in the body and behavior issues. And this is because from a neurobiology, from a neuro perspective, what happens is the body is signaled when there is inflammation in the body. We know that when there's pain in the body, there is inflammation, and that inflammation triggers the nervous system to tell the animal or the person that they need to slow down, that they need, to protect their body because there is, pain in there. They need to protect a certain area in their body. And so it activates a part of the nervous system that puts us in high alert. It puts us in a hypersensitivity mode. And if you think about it from a very basic point of view. If you've ever hurt yourself, if you've twisted an ankle, broken a leg, hurt your hip, whatever it is, hurt your back, when you go out to do your daily activities, you are a little bit more cautious about, taking a wider berth, or if if there's children running and playing, or you don't want your dog to run up and jump on you when you hurt, you automatically protect yourself, and you're more vigilant about that because you're in pain, and you are therefore vigilant around situations that are going to exacerbate that pain, that are going to cause that pain to get worse. So from a biological point of view, it makes perfect sense that we should be more hypersensitive to our environment when we're hurt, because we don't want to exacerbate that pain. We want to protect ourselves. That's the function of the nervous system, to protect you, one of the functions. So with dogs in particular, you might see more reactivity around other dogs because they don't want the other dogs to approach, or you may see reactivity to people because they don't want to be touched in a certain position or in a certain place on their body that's sore, or they don't even want them to approach altogether. And I'm not saying this is the only reason, of course, this is just one of the reasons that can either exacerbate reactivity, sensitivity, and anxiety, or in fact, it could also be one of the causes. If you had a dog that was problem-free, let's say, really casual, relaxed, no problems out, going out into the world and experiencing people and dogs, and then suddenly these things start to develop, it very well could be a sign that your dog is in pain. And pain is something that unfortunately goes very often missed. It goes very often unseen by most dog guardians. And that's because dogs are really, really good at hiding their pain. There are some wimpy dogs. I say wimpy dogs. You just like people, you get some people who are really more sensitive to pain than others. They have a lower pain threshold. And so they will show you that they're in pain. They'll lie down and they'll be stiff and they'll be sore, and they're like, oh, I'm sore and I want to go for a walk today. Leave me alone. And they hobble along. But generally, those dogs, if you are seeing those symptoms, then you know that chronic pain is so far advanced that the dog is actually really showing it. For most dogs, they don't really show their pain. If it's an acute pain, so let's say they've just had an injury, they've been running around playing and they twisted a leg or fell down, or a dog jumped on them or whatever, so it was an acute short sharp pain, you will hear your dog probably cry out in pain, maybe yelp. They might come over to you limping, and then sort of game over and they go home, and within 24 hours you find that they kind of sprung back again and they're okay. Probably some bruising going on there, but they're okay. That's acute pain, and that's where you will see your dog, actually yelp out in pain, or start limping very quickly, that kind of thing. But it's often the chronic pain. It's the pain that is always there at a lower level in the background that we miss, because dogs, you won't really see it unless you're really, really cued in to looking at changes in their gait, changes in how they get up and lie down. And I'll talk about some other behaviors that you will see with that. So it's really something to consider. Another study also showed that 80% of all adult dogs, I just want to get this right before I quote it. Whoops. 80% of dogs in the USA over the age of 7 had some degree of osteoarthritis. 80% of dogs over 7 years in the US had some degree of osteoarthritis. That's huge. But now listen to this. The other 20% show signs at the age of 1 year, and just over 1 year, around 1 year. So that's incredible, because we don't expect young dogs to have osteoarthritis, and yet they can. And studies have shown that, in fact, 20% of some dogs are already showing signs of osteoarthritis or some kind of muscular-skeletal problems at the age of 1 year old. So it is something that is really, really what do you say? I don't know if the right word is endemic in dogs. We need to take it seriously. We need to realize that our dogs don't particularly show pain, and we need to realize that it can be linked to behavior. So now we know about pain, and a lot of people are aware of pain. Some of the things to look out for, I've just written a couple of things here. When you, some of the signs, some of the behavior signs that you will see with dogs who are in pain. So I've spoken about that they may be slightly more anxious and reactive when they're out and about. They don't really want dogs coming near them. They don't particularly want to play. They don't like it when other people are approaching, when strangers are approaching, possibly because they don't want to be petted on the head. You may also see things like a lack of wanting to play. They may not be so playful anymore. You may see things like dogs that growl when they're sitting on the couch and the people come up and say, come, I want to sit next to you, and the dog starts growling. And automatically we jump to conclusions. The dog's being obnoxious, the dog's trying to take over the couch. He's trying to be the dominant one, blah, blah. No, it's actually because he's growling to say, just be careful where you sit. Don't touch me. Don't come too close to me. I'm sore. All right. Or he doesn't want to jump off the couch too suddenly, because if you've got a sore hip or a sore back, you can't exactly just jump off the couch easily. You have to take it slow. You have to leverage yourself up, and you have to get into position, balance yourself, and then jump off the couch, as dogs have to do. It's not that easy. So it takes time, coordination for them, and they can't do quick movements. Hence, hypersensitivity to noises, because they know that, if the doorbell goes or a noise goes or something goes, it means that they have to react quickly. Our dogs are like, what was that? There goes the doorbell. There goes somebody's coming or whatever. But they've also learned that when that doorbell rings or somebody's coming in, a visitor's coming in, they've got to jump off the couch quickly and run to that person. And in the past, they've done that, and it's actually hurt. It's hurt them to jump off the couch really quickly, or it's hurt them to get up from their bed really quickly and run on slippery floors. It's like ice skating when you've got a backache, to run to the end of the passage to get to the door, etc. And that's where you see these, suddenly your dog starts to express hyperactive greeting behaviors and more arousal around the greeting. The dog is dancing around and jumping and barking, and you think, oh gosh, where did this come from? Why is he starting to get so over aroused in his greeting? And that's because it's uncomfortable. They're excited to see the person, but they don't want to be touched. They're avoiding any other dogs and legs and people because they don't want to get hurt. So they kind of, going around the outside. They would love to come in the middle and say hello, but they don't feel quite well to do that. And I've seen this really often, and specifically with my dog at the back there, Charlie. I've seen this with him. I've seen his hypersensitivity, his reactivity, his anxiety start to increase when I know he's in pain. And he has osteoarthritis. He has arthritis in several joints. He has a plate in his knee, so he's got some more arthritis in there. He's got hip dysplasia, and he's got elbow dysplasia in one elbow. So he's got a lot going on for him. And I've noticed that as he is on a pain management plan, but at some stage, when things don't come together all at once with his payment plan, there may be a period where he's a little bit more sore, or perhaps a season like winter, he may be a little bit more sore, or if we've had a little bit of a longer walk over the weekend, I can see he's a little bit more stiff. And so he will show these behaviors in a more pronounced way. I will see his anxiety rise. I will see his hypersensitivity exacerbate. And I know that it's linked to his pain. So other things like, as I say, avoiding slippery floors and stairs. That's difficult for dogs who have backaches or some kind of muscular-skeletal problems. Even if it's limbs, they have to learn to balance themselves. They have to change weight, shift weight. And to do that on slippery floors, as I say, is like ice skating. It's really not comfortable for dogs. So we really need to be very mindful of slippery floors. If you do have a dog with known problems, please make sure that you're putting down mats and carpets and rugs and runners and things in your house, specifically where your dog moves, so that they're not scrambling on slippery floors, because that is the worst thing for them. It can lead to further injury, and it's obviously very painful for them when they are, trying to move around on those floors. Other things is, I've seen this so often when dogs stop on walks. They just stop and they sit down, or they refuse to go further. They want to go in another direction. And the owner's like, oh, he's so stubborn and he won't move. And, he's just so blimmin' lazy. No, very often that dog is sitting down because it's sore and they've had enough and they want to go back. And again, I see it so often, and I see owners rushing them on and moving them on and dragging them across, and they're really giving clear information. This hurts. This is uncomfortable for me, and I would rather go home now. So long walks for dogs, or what we call the weekend warriors, where people go out and they go and hike a mountain and climb a mountain and, go on a trail for 3 or 4 hours. And during the week, the dog doesn't get to do any exercise because the people are working or etc. That dog who's got that sore back or problem is going to want to go on that walk on the weekend because he wants to be with his people and he wants to get out into nature and enjoy it. But he's going to come back really sore after that adventure. And he's going to be, for the next couple of days, he's probably going to be suffering quite badly from that pain. So that's, again, we need to, with dogs with pain, we need to make sure they're getting the right kind of exercise in the right kind of amounts of exercise too. Yeah, so other things, what else? You'll see that excessive barking at noises. Sometimes dogs will, now they know they can't rush out and defend the territory, as it were, your property, etc. So their barking gets louder. So they rather bark the person away or the other dog away, as opposed to rushing up to the fence and doing it. So increased barking could be another one. Alerting without having to run there. And also obviously making sure that other dogs keep their distance. By barking, he's creating distance and space. What else? Yeah, not wanting to jump into the car, for instance. That's also one of the first signs that you see. Dogs no longer want to jump into the car. That's generally because they have to jump up into an unknown space, into a darkened space, or into a small space. So they really have to coordinate themselves, and that can be quite tricky. And also jumping out of a car. So those are some of the other things. What else did I write? Yeah, so that's basically, those are mainly the ones that you will see that are related to pain. I still got 10 minutes. So I'm going to just talk a little bit about some other ones that are less common and less easy to notice the correlation between the behavior and the illness. And that's where it's not necessarily has to do with pain, but it's got to do with the illness or the disease itself. One of them is ear infections. And we know a lot of dogs get ear infections. And anybody who's had an ear infection knows how very, very painful it is. And that pain can last a long, long time. And generally, we need to have antibiotics and all sorts of things to clear up that infection. But still, that pain can go on for a long time. And with dogs, it's known to cause sensitivity to touch. So they don't want to be touched on the head anymore or anywhere near their ears, because it's obviously really, really painful, but also post the event. So even once that infection has cleared up, it's known that dogs are still sensitive for months and months, if not years afterwards, being touched on the head or the ears. And that is because what's called remembered pain. So they remembered, that pain in their memories stays with the ears for a long, long time. And they remember that people touching them on the ears is very painful. And so it's almost like something they then from then on always avoid, is being touched on the head or on the ears. So this is something that, very hypersensitive dogs to being touched anywhere on their body, for me, is a big question mark. There are dogs who don't like to be touched, who like their personal space, but very often, very, very often, you can put a tick. If you have a dog who's anxious, who's reactive, who's hypersensitive, who's easily aroused. They are generally all, I would say a good 99% of them are also body sensitive, contact sensitive. So sensitive to touch, sensitive to being stroked on certain parts of their body, etc. There is definitely a correlation there. And when you think about the skin being filled with nerves and it's the biggest organ of our body covered in nerve endings, then you can imagine why. If the nervous system is hypersensitive, then you're going to be sensitive to touch as well. So ear infections is one. Dental pain is something that you don't see. Dogs don't walk around going, I've got a sore tooth. And only if, some dogs will go off their food, others won't. Others will continue to eat as normal. They may not want their meaty bones, but they may continue to eat as normal. Things that I've seen in dogs that have dental pain is there a lot of, lip smacking and drooling and that kind of thing, or rubbing their face on a carpet or the floor, or in the grass or something like that, generally indicates that the dog has pain. And very often, you can only see the front teeth, the canines and the front teeth. You don't get to see the back teeth with your dog very often unless they are used to you looking in their mouth and open wide. So having, your vet check their teeth, certainly all the way to the back, is a very good idea. And to make sure that there's no infection or pain or broken tooth or cracked tooth there, because that's also one that goes unnoticed. Muscle aches and pains, I talked about, weekend warriors when we overdo it with our dogs that are not fit enough. Another thing is dogs who pull on the lead a lot. So dogs who really spend a lot of time leaning into their harness, or feel like you've been pulling you around for years. We need to sometimes put a question. It is a lot of the time it's about learning to walk in balance, learning to be comfortable on a leash. Dogs that have they got enough room to move on the leash? Are they comfortable? Have they learned to walk on a leash with you? Because it's a skill that we have to learn with our dogs. It doesn't come naturally to dogs. They weren't born on a leash. So if we haven't done that already, sometimes it is also a question mark. Why is my dog consistently pulling, even though I've tried to communicate and I've learned some leash techniques, etc., and my dog is still pulling? Question mark. Why is my dog pulling on the leash all the time? Is it because, for instance, my dog is sore behind and they're pushing their weight forward onto the front legs, and then it's easier to trot to get momentum, as opposed to walking slowly, boom, 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 and using all my limbs? Question mark. Another question is, if you do have a dog who's been pulling for a long time, what kind of shoulder pain do they have? What kind of neck pain do they have? It's huge, when we think about a dog just leaning onto the leash. Okay, it's not choking itself, but it's just leaning onto the leash day in, day out, every walk. Then we know that dog has got some kind of pain or some kind of discomfort happening for them. So these are things to be really aware of. Another one is things like allergies. So many dogs have allergies and IBD, irritable bowel syndrome, or some kind of gastrointestinal symptoms. Okay. And this again is, we think, yes, shame, sore tummy, they don't want to eat, that, they don't feel hungry, or they're vomiting a lot, or, those kind of things. But just think about it. Think about having chronic diarrhea, chronic vomiting, chronic nausea. The nausea comes with the vomiting. That chronic feeling of, juices gurgling in your tummy, and then pain, cramps from those GI things. So it's, if a dog has chronic GI issues, they are chronically in some kind of discomfort and pain. Again, they may not show it in everything, but they will possibly show it in their hypersensitivity and their anxiety and in their behavior, in a way that we need to put those two and two together and say, my dog's really not feeling comfortable. That's why he doesn't want to be in crowds. That's why he doesn't want to be at the park playing with the other dogs. He would rather be sniffing around on a nice, relaxed, calm walk with his person. So think about that. Allergies, itchiness. Anybody who's had eczema or chronic itching or allergies themselves knows how irritating it is to have an itchy skin, a constantly inflamed, red, raw, itchy skin, that the dogs can't get to every part of their body where it's itching, like up on their back or under on their tail, etc. Sometimes they can't get to it. But those kind of things, we need to be really mindful of how having that chronic itch is really debilitating for dogs and can cause them to be grumpy and to be anxious, all of those things again, anxious, hypersensitive, reactive, don't touch me, don't come near me, leave me alone, I'm not feeling well. And so we need to be mindful of that. Another one, last one, I think I've got just one more minute, couple of minutes, one more thing is is when our dogs are on medications and some kind of diseases. So I'm going to give you an example. I just recently had COVID and I lost my sense of taste and my sense of smell for a good 3 weeks, I would say. My sense of taste is coming back again. My sense of smell is still dull. It's getting there, but it's still dull. And I think of the uncomfortable feeling it was for me when I first had no taste and no smell. But I was aware of it. I knew it was one of the symptoms of COVID, and I kind of knew what to expect, although it was weird experiencing it. It was pretty weird experiencing it, and sometimes pretty frustrating, especially because I love my essential oils and I couldn't smell any of them. But it was something that I was aware of, and I knew that it was likely to pass. But now put your dog in a position, and we don't know that dogs also don't get infections that could cause a loss of taste or a loss of smell, because there are other infections that have this as well. It's not just COVID. There are other things linked to often to sinus problems. People can lose their taste and smell temporarily. So there are certain illnesses that cause these symptoms. Now think of if we compare the dog's sense of smell to our sense of sight, because that is their main sense, that they get their information from the environment. Can you think of walking around blindfolded for a couple of weeks? Because it's the same for them if they've lost their sense of smell. They have their eyes to then rely on, but it's not the same. Their world has changed. Their interaction with the environment has changed in a big, big way. They cannot smell another dog's urine to know if there is another dog in the neighborhood that they don't like that is close to them or out on the walk at the moment. They're getting all this kind of information all the time. And when they've lost their sense of smell, it's almost like blindfolding yourself and going on a walk. So I think we need to be really, really mindful of all these little physiological changes that could be happening inside the body that we're not even aware of. Other things like if your dog is on medications of any kind, you pick up any medication box and read all the side effects, possible side effects. We can take a medication and say, oh no, this doesn't feel good. I feel nauseous. I feel dizzy. I feel wobbly. I've got a headache. How do we know if our dog's got a headache? How often do we get headaches? So these could be all sorts of side effects to all sorts of things that we are unaware of that is going on inside our dog. And this is a huge piece that is often missed when dealing with behavior challenges. You take your dog to a trainer or behavior therapist to say, my dog's doing XYZ behavior. I need to fix this behavior. But when the underlying cause is actually something going on internal, you're not really going to be able to have much success fixing that behavior or trying to. So something to be aware of, something for us to think about. Make sure that you are having your dog checked over regularly by a health professional. And I also want to err on the side of caution. Your general vet, that you take your dog to for annual checkups and things like that, is not necessarily a specialist in osteoarthritis or not necessarily a specialist in pain kind of issues. I mean, yes, they're trained to recognize some kinds of pain, but again, unless you give them the correct information, they won't be able to make a diagnosis, because very often we know dogs go to the vet and they are nervous anyway. And so they freeze up And if the vet pushes here and the dog does not want to show the pain because he's nervous and he doesn't want to, he wants to just get through this, he's good. The vet might push him, around, move joints, and the dog shows zip, does absolutely nothing. And then we think, both the vet and the person say, oh, well, he can't be in pain because he didn't do mix or max or moo or ma. Not every dog is going to react. A lot of dogs shut down at the vet. They literally go into survival mode and they just freeze and allow any procedures to happen. And they're not going to show you that there's pain. So all the other kind of symptoms that are happening behaviorally at home are what you need to take to the vet and report. My dog stopped jumping in cars. My dog started growling me if he's sitting on the couch. My dog sleeps on the bed with me, and now every time I roll over at night, he starts growling and he jumps off. Bing. That's a symptom. My dog's become hypersensitive to sound. My dog has become more overreactive with other dogs. My dog won't let people touch him anymore. My dog won't let me touch him anymore. All of these are symptoms of what's going on in the body. They're not necessarily behavioral issues. They're symptoms of what's going on in the body. So be an observer and make sure that you know your dog. Watch their habits so you can see when they change, when their behavior changes, and start to become your dog's advocate so that you can speak up for him when he may have problems that are not that visible. So that's it for today. Spot on, a half an hour. I want to thank you very much for joining me this morning. I hope you got something out of this. And if you have any questions or comments around this video, I would love for you to reach out to me and get in touch. Let's chat about it. I do offer a 30-minute free support call, discovery call, which you can book with me, and we can have a chat about what's going on for you and how I can possibly work with you to resolve that. And that's a free call open to everybody on my mailing list. So if you're here, please go ahead and put your comments either below this video if you're watching it on the replay, or back in the group, or send me a newsletter. Thank you very much, everybody, and have a lovely day. Bye-bye.